Hello. So in this video, I'm going to discuss the problems that you might encounter when using arterial pressure monitoring. So two concepts that are important to get our heads round include the ideas of damping and resonance. So damping is caused by the dissipation of stored energy. Anything that takes energy out of the system results in a progressive diminution of the amplitude of oscillations. So this diagram here shows the damping of different arterial monitoring systems. Figure A here shows an optimally damped system. An optimally damped system will have a damping value of 0.64. This figure here, figure B, shows an underdamped system. When there is an underdamped system, this causes an over-display of the systolic blood pressure and an under-display of the diastolic blood pressure. And this figure here, figure C, shows an overdamped system. And in this system, we have an under-reading for the systolic blood pressure and an over-reading for the diastolic blood pressure. And excessive damping can be caused by air bubbles, clots within the system, or highly compliant tubing. And if we now discuss resonance. So resonance occurs when the frequency of the driving force coincides with the resonant frequency of the system. So the fundamental frequency is the frequency of the driving force, and the natural frequency refers to that frequency of the system. So if the natural frequency is less than 40 Hz, it falls within the range of the blood pressure, and a sine wave will be superimposed on the blood pressure wave. We can have problems with increased resonance, and this can cause an overcalculation of the systolic blood pressure and an undercalculation of the diastolic blood pressure. So moving on to the fast flush test. We can use a fast flush test to determine the optimum damping of the system. So when we perform a fast flush test with a driving pressure of 300 millimeters of mercury, we have a square waveform which will be displayed on the monitor, followed by oscillations. So in an optimally damped system, as we say here, we'll have a square waveform followed by 2 or 3 oscillations before settling back to 0. In an overdamped system, as we see here, it settles straight back to 0 with no oscillations. And in an underdamped system, here, there'll be oscillation for more than 3 to 4 cycles. So now going back to discussing the problems with arterial pressure monitoring. So we can classify the issues into equipment and patient factors. As we've already discussed, the issues with damping, resonance, and the fast flush test all relate to equipment issues. Other equipment issues we have is that the transducer needs to be at the level of the right atrium. There needs to be periodic checks and zeroing of the system, and this is to prevent baseline drift from the true values. Now if we look at some of the patient factors that can cause us issues with arterial pressure monitoring, this includes ischemia distal to the arterial cannula, the risk of arterial thrombosis, risk of bleeding at the site of insertion, inadvertent drug injection, local infection at the site of insertion, which then can lead on to systemic infection, and we need to be cautious where not to insert arterial lines. And this would include at sites where there is a suggestion of infection at the skin, or sites where there is trauma. Thanks for watching this video on the problems with arterial pressure monitoring.